In terms of limit setting, you need to always be doing what's comfortable in your family and in your culture, given all considerations, the religion, culture, etc. But then also be very respectful of the child's sensory system, so you don't want to overload a child who's sensory overreactive. You don't want to isolate a child who's underreactive, because that puts them in further self-absorption. So you want your limit setting to be developmentally facilitating, as opposed to undermining. And so you take your child's profile into account. But then, whether it's sitting quietly with daddy in the room and kind of giving you a little lecture, or whether you have to do extra chores around the house, or whether you lose your favorite TV privileges.
At 5?
You set the limits based on the developmental age in terms of the functional emotional milestones the child is at. If he's 5 but operating like a 3.5-year-old, you make your limits appropriate to a 3.5-year-old. So set your limits based on his functional emotional developmental age, not his real age, and always increase floor time proportional to the limits. So whenever you're doing more limit setting, increase your floor time proportionally, and that will almost always be successful.